Good afternoon, Senator Larson, Representative Scanlon, and members of the Assurance and Real Estate Committee. My name is May Flexer. I'm a state senator from the 29th District, and we collectively are here today to speak in support of proposed House Bill 5210, an act mandating insurance coverage of essential health benefits and expanding mandated health benefits for women, children, and adolescents. I'm proud to be joined by my colleagues and the co-introducers of these bills, Representatives Christine Conley, Liz Lenahan, Kristen McCarthy-Vahey, Robin Porter, and Caroline Simmons. The Patient Protection and Affordable Care Act, otherwise known as the ACA, has expanded health care access to hundreds of thousands of Connecticut residents, and we strongly believe that our state government must act to preserve key provisions of this law that directly affect the health and well-being of Connecticut residents and especially Connecticut women. With a Congress that is committed to revoking the ACA, it is imperative that we codify its provisions at the state level in order to maintain the peace of mind Connecticut women and Connecticut residents have enjoyed during the past several years. We have identified 10 benefits which we believe to be absolutely essential in preserving women's health, benefits that have been directly under the attack from the Trump administration. These include outpatient care, hospital care and trips to the emergency room, prenatal care, prescription medicine, lab tests, mental health services, substance use disorder services, and children's preventative care. Policy which prioritizes these essential services will not only keep Connecticut residents healthier, but will lower costs as well. Additionally, we recognize the vital role that reproductive and maternal health play for both women and children. The effects of policies which deny women affordable maternal and reproductive care have a ripple effect on society and the economy, which leaves no one, women, children, spouses, or entire communities, untouched. Over 80% of Americans who gained access to insurance through the ACA come from working families, and women using birth control have saved hundreds of dollars per year because of the ACA. Access to contraception allows women to work and plan their lives, choosing to have children at a time that is best for them and their family. This benefits women and their household and bodes well for the long-term success of their children as well. It is imperative that our state recognize the connection between women's health access to subsidized contraception and lower rates of unwanted pregnancy. Put simply, women cannot use birth control if they cannot afford it. More than 90% of women will use contraception at some point in their lives. Connecticut's falling rates of abortion, unattended pregnancy, and teen pregnancy can all be directly attributed to increased access to contraception. At the same time, we must still grapple with bringing down the higher rates of infant mortality and low birth weight for Black and Latino babies in our state. Knowledge of services covered by the ACA still remains limited, and maintaining coverage will help us continue to grow awareness and usage. This is why we are determined to codify into Connecticut law the ACA requirement that insurers cover birth control and women's preventative services with no out-of-pocket costs. With this legislation, we will solidify Connecticut's role as a leader in the fight to make health care affordable. Due to actions by the Trump administration, patients with pre-existing conditions can no longer enjoy the same peace of mind as they did when the Affordable Care Act existed in its original comprehensive state. We believe that no patient should be forced to live with the possibility of their insurers refusing to cover more costly services that they desperately need. And by enacting these provisions, we can ensure that medical costs will no longer have to potentially cripple working families. Connecticut has always been a leader in ensuring women have access to whatever healthcare services are right for them. It was in our state when married couples first gained the right to access birth control in Griswold v. Connecticut. It's where the first state legislature codified the right to choose whether to continue a pregnancy as determined in Roe v. Wade. Here in Connecticut, we trust women to make their own health care decisions. House Bill 5210 and 5208 will continue that strong tradition. Thank you for this opportunity and to testify before you today, and we are happy to collectively take any questions that you may have.